Okay, let's dive right into this. Welcome to today's Explainer, where we're going to walk step by step through the House of Health IV Iron Infusion clinical pathway. Now, if you've been feeling absolutely drained, or if a doctor has just told you your iron levels are critically low, trying to navigate the medical steps to actually get that fixed can feel, well, a bit overwhelming. But it really doesn't have to be. Today, we're going to demystify this whole process from start to finish. We're setting out a clear, structured path so you know exactly what to expect from this highly specialized treatment. So let's start with a really common frustration. Are you struggling to absorb oral iron supplements? Because for so many people out there, taking standard iron tablets feels like a total losing battle. You might be dealing with constant crushing fatigue, struggling with heavy menstrual loss, or maybe your stomach simply cannot tolerate the harsh side effects of oral iron. If taking those pills just leaves you feeling nauseous or constipated without actually moving the needle on your energy levels, you are absolutely not alone. And the good news is there's an incredibly effective alternative.
And that brings us to the core of our explainer today. What exactly is an IV iron infusion? Well, it's a medical procedure that delivers iron directly into your bloodstream. Now, the absolute key phrase to remember here is bypassing the digestive system. Think about it. When you swallow an iron pill, your gut has to break it down and absorb it, which is often highly inefficient and frankly really irritating to your stomach. By putting the iron directly into your veins via an intravenous drip, we completely bypass the gut. It's like taking the express lane. This allows for rapid, complete absorption and a much faster restoration of your body's vital iron stores.
So, who actually needs to go this route? There are quite a few common clinical reasons. Beyond simply not being able to stomach oral tablets, some patients need urgent iron restoration, maybe because they've got a surgery coming up really soon. Others have what's called functional iron deficiency. That's where your storage levels might technically look okay on paper, but your body just can't use the iron effectively. And importantly, if you have chronic conditions like kidney disease, heart failure, Crohn's or celiac disease, your gut simply might not be capable of absorbing iron naturally at all. Add to that the heavy demands of pregnancy or heavy menstrual blood loss, and you can really see why bypassing the gut is a true game changer for so many people.
So here is our roadmap for today's explainer. We'll quickly cover the mandatory safety prerequisites, walk through your Thursday treatment journey, break down the transparent treatment pricing, and wrap up with aftercare and your expected results.
Let's jump straight into Part 1, Mandatory Safety Prerequisites. Now, I want to be clear right off the bat. These checks aren't just bureaucratic hurdles meant to slow you down. They are absolutely vital clinical safety measures. They ensure you get the exact right dose safely and effectively. There are 3 mandatory steps you've got to complete before any infusion slot is confirmed. Step 1 is having recent blood tests, specifically a full blood count and a full iron profile. Step 2 is filling out a comprehensive online pre-assessment form, and Step 3 is a direct pre-consultation with a doctor. These 3 pillars basically guarantee that the clinical team at House of Health knows exactly what your body needs before a single drop of iron is ever prescribed.
Let's zoom in on Step 1 for a second, because this is where patients always have questions. The crucial detail here is that your blood test results must be extremely recent. You basically have 2 paths. Path A, you already have your full blood count and iron profile results from your GP or another clinic, and they're from the last 6 to 8 weeks. If that's you, fantastic, you can move right ahead. There is a temporary exception allowing results up to 3 months old, but really that 6 to 8 week window is the strict clinical gold standard. Now, what if you're on Path B, meaning you don't have recent bloods? Well, you can't skip the step, but don't worry. House of Health offers an in-clinic iron studies panel for $150, and those results are typically back in just 24 to 48 hours.
Right, so once your bloods are sorted, you move to the doctor's pre-consultation. This is a mandatory 20-minute clinical review. The doctor's going to sit down, look at your blood work, confirm you're actually eligible under clinical guidelines, do a deep dive into your medical history, and most importantly, check for any allergies. IV iron carries a very small risk of an allergic reaction, so this step is absolutely critical for mitigating any risks. Only after this rigorous check is complete will the doctor safely prescribe your exact personalized infusion dose.
Okay, moving right along to Part 2, your Thursday treatment journey. Now, you might be wondering, why did they specifically say Thursdays? Well, at this CQC-registered facility, patient safety is the absolute top priority. The clinic enforces a strict rule. IV iron infusions are only booked on Thursdays. Why? Because that is the specific day the consultant gastroenterologist and the lead specialist nurse are physically present in the clinic to oversee every single session. Having this high-level specialist clinical oversight just guarantees that your infusion is managed safely and expertly. And trust me, when it comes to IV treatments, you definitely want the specialists in the room. So, what actually happens when you arrive on that Thursday? The in-clinic experience is actually surprisingly relaxing. You'll be made completely comfortable, and the specialist nurse will carefully set up the IV drip. The clinic uses a highly regarded premium product called Pharinject. The whole administration process takes about 45 minutes to do safely. So you can literally just sit back, read a book, or listen to some music while the iron gets safely delivered straight into your system.
Let's shift gears to Part 3, transparent treatment pricing.
Nobody likes hidden fees, right? House of Health is completely transparent about the costs for this clinical pathway. Here is the exact step-by-step breakdown. If you need that in-clinic blood testing panel because you don't have recent results, that's £150. The mandatory 20-minute doctor's pre-consultation is £50. But, and this is a really great detail, if you are deemed eligible and you actually go ahead with the drip, that £50 fee is fully redeemable against the cost of the infusion. Finally, the Pharinject IV Iron Infusion itself is £650. That covers the bespoke dose calculated by the doctor based on your specific bloods, all administered under that specialist Thursday supervision. So, no surprises, just straightforward, transparent clinical pricing.
And finally, the best part of the journey, Part 4, aftercare and expected results.
Okay, you've had your infusion and you are heading home. Let's talk about immediate post-treatment care. The instructions for the rest of your Thursday are super simple. Go home, rest, and hydrate really, really well for the remainder of the day. You also must strictly avoid alcohol on your treatment day. No exceptions. Now, let's talk side effects just so you aren't caught off guard. You might experience a mild metallic taste in your mouth or maybe a slight headache. Some patients also get what's commonly called iron flu, just some mild flu-like aches. The absolutely crucial point here is not to panic if you feel a little under the weather that evening. These symptoms are generally very brief, and they will resolve on their own as your body processes this massive influx of a vital mineral.
And now, the timeline of your recovery. This is truly where the magic happens. Between 7 to 14 days post-infusion, you should start noticing a real shift. Your core energy is going to begin to improve, and that awful breathlessness you might have been dealing with will start to fade. As we hit the 3 to 4 week mark, this is where your results really peak. You'll see noticeable gains in your physical strength, your brain fog will lift, making it so much easier to concentrate, and you might even see a vibrant improvement in your skin tone. And beautifully, your iron stores can remain improved for literally 6 to 12 months after just this single infusion. Finally, between 4 to 8 weeks out, it's highly recommended you pop back to the clinic for a follow-up ferritin check, just to measure exactly how well your body has responded to the treatment.
Which brings us to our final thought today. Are you ready to safely restore your iron levels and finally reclaim your energy? Look, you don't have to just live with crushing fatigue or settle for oral supplements that make you feel absolutely awful. By understanding this highly structured, safety-first clinical pathway, you can take total control of your health. If you are ready to stop feeling drained and start feeling like yourself again, the team at the House of Health Clinic in Birmingham is ready to guide you through this exact journey. Thanks so much for joining me on this explainer today, and hey, here's to reclaiming your vitality.